Good afternoon. This is Cynthia Kanaki with the ALS Association. Thanks so much for carving time out of your Monday afternoon to join us. This is one of a series of monthly Living with ALS educational topic call webinar series. Each month we bring information of a practical nature to people living with ALS, along with their caregivers, ALS Association chapter members, and ALS Association multidisciplinary clinic staff. Today's topic is the ALS Focus Survey Program. We have two guest speakers joining us today. Jill Yursek is Vice President of Mission Strategy with the ALS Association. Dr. Yursek's academic preparation and research focused on biology, neurodegenerative disease, and ALS-specific disease models. She oversees the strategy of projects and programs that span the association's efforts related to research, care, and advocacy. Along with Dr. Yursek is Dr. Sarah Parvanta. Dr. Parvanta is the director of the ALS Focus Program. She holds a master's degree in public health and a PhD in communications, and she specializes in survey design, data analysis, and studies on health perspectives, and very importantly, quality of life. Dr. Parvanta, I believe you are online and have your slides available. As Dr. Parvanta begins her presentation, please submit your questions or comments in the chat box, and at the end of her presentation, we'll be able to review those for comments. Dr. Parvanta?
Thank you so much. It's a pleasure to be here today, and thank you for everyone who is joining this webinar today. I have the pleasure to talk about the ALS Focus Survey Program and the goals for this program around learning what matters most for people with ALS and caregivers. ALS Focus first launched in the spring of 2020, so some of you might have heard about this program or even participated in the last couple of months. But I do want to provide a brief refresher on what this survey program involves. It is an online survey program where surveys can be taken in the comfort of one's home or even on a mobile device. This survey program welcomes people with ALS, current caregivers, and past caregivers to participate in surveys. All participants need to be at least 18 years old and living in the United States. ALS offers different kinds of surveys on a rolling basis, and these surveys ask about symptoms, burdens, and everyday impacts of ALS on daily life. And that's both from the perspectives of people with ALS and their caregivers. The goal is to use these survey results to improve drug development, clinical trial design, clinical care, and home health for people with ALS and their caregivers, as well as advocacy efforts and other policy-related efforts. And here you see a picture of the ALS Focus homepage where participants can register or sign in if they've already registered and continue to take surveys. I want to take this chance to show you all a little bit more about where to participate if you're interested in taking these surveys and letting us know about your perspectives related to ALS. So the homepage with all of the information on ALS Focus is als.org/ALS Focus, and that's listed at the top of the screen here. We'll also be making these slides available at the end of the webinar, so you'll have all of these URLs and links. So new participants especially, we encourage you to go to this webpage first so you can get a lot of information on everything that ALS Focus entails, who the members of our Patient and Caregiver Advisory Committee are. Those individuals help us to design survey topics and survey questions, and you can get a sense for privacy of the data that is collected and how the data will be used. And I'll go over some of that information in this presentation. So first-time participants can go to this page, and then you see over on the side, there'll be a whole panel where you can click to register for ALS Focus. After you read through the information, there are registration instructions there, and then there's other information on past survey results, which I'll go over today, and more information on who is part of our broader ALS Focus research team. For returning participants, if you've already provided survey responses in our previous survey last spring, you can come back to the ALS Focus survey portal and log in using your registered email and password. You don't need to re-register for the program. At this point, you're already set up and you can continue to take new surveys whenever they're available. Once you are registered and logged into the ALS Focus survey portal, you're going to see something like what's up on the screen now, which is the survey menu. And this is where every participant will have a tailored set of surveys depending on whether they're a person with ALS or a caregiver. And they can complete those surveys one by one. We encourage you to complete this About Me survey first, where you can provide information on your demographics and ALS related history. So we have a very good sense of who is participating in these surveys, and that helps us to interpret the results from the different survey questions with even more insight and understanding of what the needs are along the progression of the ALS disease and where people are coming from. We also have several new survey topics in the Focus survey portal, and these are available now. Most importantly, our summer 2020 ALS Focus survey topic is on what matters most to people with ALS, and so I'll talk more about this now. We have designed this survey to have a better understanding of how ALS symptoms impact the lives of people living with ALS. And we've worked with researchers who designed the questions in this survey to help measure those symptoms and the impact of those symptoms on people's lives. Not only are these questions for people with ALS, but the perspectives of caregivers are equally important. And so we encourage caregivers to complete this survey as well and let us know about what you think are the symptoms that impact the lives of the people that you care for. Your opinions will help the community create ways to improve quality of life for people with ALS and caregivers. And that's why we want members of this community to let us know what their experiences, needs, and perspectives are, so that programming and other initiatives can be designed around the opinions and perspectives of people in those communities, the communities that those programs serve. Like I said, the summer 2020 survey is open now, and so it's possible to go to the ALS Focus website and start participating. In the meantime, I want to backtrack a little bit and tell you about results from the first ALS Focus survey that was out last spring. That survey was on understanding insurance needs and financial burdens. We had 444 participants who took the survey, and that included 204 people with ALS, 118 current caregivers, and 122 past caregivers. One of the main findings from this survey was that people with ALS are reporting that they have experienced debt as a result of ALS treatment or caregiving. We asked a question of the people with ALS and the caregivers in the sample, and we asked, have you ever experienced debt due to needing to have ALS treatments for yourself or needing to provide caregiving to someone with ALS? And 1 in 4 people, 25%, said that they did have to borrow money or go into debt because of their ALS or needing to provide care. And that's represented here in the yellow part of this pie chart. We also asked people with ALS and caregivers whether they had to work longer than planned after an ALS diagnosis. So did they have to work longer than planned after they were diagnosed themselves or after someone was diagnosed that they needed to care for? And again, 25% of the people in our survey said that they did have to work longer than they planned after an ALS diagnosis. And of this group, 42% said they had to continue to work to maintain health insurance, either for themselves as the person with ALS or as a caregiver needing to maintain health insurance for the person that they cared for. We also asked the sample of this survey whether or not they lost health insurance after an ALS diagnosis. And so both people with ALS and caregivers answered this question. And 10% of the sample, 1 in 10 people, said that they did lose health insurance after an ALS diagnosis. And of that group, 67%, so a large majority of those people, said they lost their health insurance in part because they needed to stop working due to their ALS or needing to provide ALS care. We asked people with ALS in the sample about financial stress related to their ALS. And we had a number of different types of financial experiences. And we asked people to rate their stress on a scale of 1 to 5, where 1 represented not stressful at all to me, and 5 represented very stressful to me. And then they also had the option to say, this experience actually isn't applicable to me. So of the experiences that we asked about, these 4 were among the top stressors. And these included covering the cost of medical treatments related to ALS, covering the cost of medical services, and understanding health insurance coverage, and managing medical bill paperwork. So in all of these circumstances, 40% or around 40% of the sample said that this was highly stressful to them. They rated it as either a 4 or 5 on a 5-point stress scale. So we can see that these different experiences are accounting for quite a bit of stress for people with ALS who responded to this survey. That is just a handful of results from the survey, and we will have many more, and we will be sharing those in different ways. The results from this ALS Focus survey and other ALS Focus surveys can have a big impact on the programming, advocacy, policy, and care initiatives that different stakeholders take. So what we saw from this first survey was that financial burdens definitely warrant attention. Borrowing money was definitely an issue for the people in this sample. Working longer than planned was a burden that people had to deal with. And also, people with ALS face a number of different financial stressors. They already have a lot to deal with. There are a lot of challenges when dealing with this disease. And so what are ways that that different stakeholders can address financial needs and insurance needs to help reduce those stressors for people in this community? So those are some of the insights that we're able to gain from these ALS Focus surveys, and that's why it's so worthwhile and important for members of the community of people with ALS and caregivers to participate. A couple of other ways that the results can be used. First and foremost, ALS Focus participants can see how their own experiences compare to the experiences of others that are facing similar challenges. So they can respond to these questions and then see what the overall results are on average across their community and see how their experiences compare. The ALS Association also will be assessing results from this survey on insurance needs and financial burden, as well as all ALS focus surveys to improve care and advocacy and policy initiatives. We can also use the results to improve programming at the ALS Association chapter levels. These results can be broken down by zip code and different regions of the country. And so chapters in those regions can understand what the people in their region specifically are dealing with, whether it's insurance, finances, or other kinds of issues that ALS focus surveys cover. And finally, we intend to publish research papers, both within our own research team, but also other researchers are able to analyze data from ALS focus surveys and publish papers to expand ALS knowledge. And that kind of evidence is what helps support policy change. So ALS focus survey data are de-identified so that no one who participates has their name attached to any of their responses. All of the data are de-identified, and then those data sets are made available to the research community. So if someone else wants to use those data to answer a research question or gather evidence that they need for some sort of initiative or kind of advocacy effort, they can use those data and they would be freely available. So this only serves to expand the possibilities, expand the impact of ALS focused survey data. It's not limited to what our research team does, but what all researchers want to do with these data. Definitely, there are some really important reasons to participate in ALS Focus, and we always welcome people with ALS and caregivers to become part of this survey initiative. It is a way to ensure that your opinions contribute to your community. Survey data overall creates strength in numbers. The more people who participate, the more robust and compelling the results become, and the more people will take notice of them. And we can use those data as evidence to create change and create action in this community. These surveys and the survey questions that we include in ALS focus surveys are intended to help shape care, clinical trials, advocacy, and policy efforts. And that's why we work with a group of people with ALS and caregivers to know what kinds of needs and experiences are most important to this community, and we shape ALS focus surveys around those. And so we have the most important links related to ALS focus reported on this slide here. One is the main page with all of the information, and then the other is the direct link to the ALS Focus portal, depending on whether you're a new participant or a returning participant. I wanted to take a moment to return to the registration process for new participants, because this is in fact a research study, and so there are some steps, as opposed to you click a link and then you start answering a couple of survey questions. We have a process here which enables us to de-identify the data and get the information that we need so that we can then make these de-identified data available to the research community. This study also has approval from an institutional review board, and so the process follows requirements that are needed for that, to have that kind of approval. So first, as a new participant, you would sign up using your email address and you would select your own secure password. You would then receive a confirmation email to the email address that you specified, and you have to click on a link within that email. And that's a really important step. Sometimes it can take a few minutes for that confirmation email to arrive, so you might not see it right away. The next step after clicking the confirmation email is to sign into your account using your email address and password. And then this is a kind of a unique step to ALS Focus. Even though at this point you are already registered, you must add yourself as a user on your account. And the reason this feature is available is so that if a household has multiple people who want to participate, such as a person with an ALS and their caregiver, both of those individuals can participate on the same account rather than having to manage multiple accounts. So there can be one account with multiple users on that account. Each of those users would have a different username, and then those individuals can take the ALS Focus surveys under their own usernames. The next step is, after creating a user on your account, is to complete a consent form, which is very typical of approved research studies. And then to create your NeuroGUID. This is a neurological global unique identifier, and this is an alphanumeric code that helps to de-identify your data. So here is an example of the questions that are asked when generating your global unique identifier, which for this study is called a neurostamp. So you will see some questions asked for your first name, your date of birth, the city where you were born. And these definitely can seem like personal questions or identifying questions, but in fact, after you enter this information and you click Generate Neurostamp, all of this personal information disappears, and basically we would never see any of those responses that you enter here. All we see is the random code of letters and numbers that is generated, and that constitutes your global unique identifier. So it's a special string of letters and numbers that's unique to every participant who is part of ALS Focus. So creating a NeuroGUID is an important step, and people with ALS should create their own NeuroGUID. Caregivers should create their own NeuroGUID. No one should have the same NeuroGUID. After entering all of that information for yourself as a user, any of the other people in your household who want to be on this account can be added as users on that account. The next step is to start taking surveys, including, most importantly, to complete the demographics questions so that we know who is participating in terms of their age, gender, and other kinds of characteristics. We don't need to know people's names, but we do want to know, we do want to have a way to analyze ALS Focus survey results according to different kinds of demographic categories, because that helps us make even greater, even stronger conclusions about what is needed depending on someone's demographic group. After completing the demographics, all surveys that are currently active are available to the participant, and we encourage people to complete as many of the questions as they can. And we have designed each of the surveys to be very short, so it's possible to complete one and then come back and complete other ones later, and they should only take a few minutes each. If anyone has some difficulty using computers or devices, someone else can take the surveys on their behalf as long as they have their permission. So it doesn't have to be, if the person with ALS wants to have someone complete a survey or fill in answers on their behalf, that is perfectly fine. We do have a instruction page with all of the step-by-step instructions on how to register and start taking surveys. And then if anyone has any questions, this is the email address, and myself and my team will be able to respond to you and help you with any sort of technical questions that you might have. Thank you so much for listening to this presentation and for your support and interest in the ALS Focus program. We look forward to growing this program, and we hope that you will talk about this program in your communities and let us know if you have any questions about it. And I'm happy to answer questions now.
Great, thanks so much, Sarah. Really appreciate that review of a survey that was launched in the springtime about insurance and the financial impact of ALS. And now I understand you have a new survey ready to launch moving forward. I would also like to invite all of the viewers, if you have any questions or comments, please submit them in the chat box. I'll vocalize them for the convenience of all the folks that are on today's webinar. So submit those questions or comments for Dr. Parvanta. Question, Sarah, research is so important to everyone with ALS, and outside of test tubes and Petri dishes, why is it valuable to hear from people with ALS about how the disease is impacting their life?
Yeah, that's an excellent question. And one of the benefits, I think, of participating in ALS Focus, we hope anyway, is it's an opportunity to participate in research apart from clinical trials. Of course, participating in clinical trials is good opportunity, but in cases where someone wants to participate further in research that helps this community, these kinds of surveys are an easy way to participate in research from the comfort of one's home. And so taking these ALS focused surveys and answering the questions that are more about experiences, preferences, perspectives, which is quite different from a clinical trial. This creates a data source on quality of life, on what matters to people who are living with this disease and caregivers who are taking care of them. All of these kinds of data points on quality of life can inform the kinds of treatments that are designed for people with ALS. Do certain treatments ultimately improve quality of life? That can be an important indicator because obviously people want to be able to live their lives to the fullest and feel happy and spend time with their friends and family. So knowing what matters to people in terms of quality of life gives us some benchmarks for then creating programs to try to improve those types of outcomes. If we don't know what matters most to this community, we wouldn't know, we wouldn't have as great a sense for what kinds of programs, what kinds of clinical trials and therapies would be most worthwhile to the community. And so this is a way to create a data source that then allows advocates, policymakers, programmers, and care service providers, as well as a pharmaceutical industry, to allocate their time and efforts in ways that will best serve the quality of life of the people in these communities.
I see. So, and a quick follow-up question, somewhat related. there are a lot of hoops and restrictions related to the different clinical trials and different research projects. Can the information that's gathered by these ALS focus surveys be used by the people who design the clinical trials and the other research projects?
Yes, thank you for asking that question. ALS Focus survey data uses that NeuroGUID, the Global Unique Identifier, and that identifier is attached to all of the different survey responses for each participant. And then if those participants have also been part of a clinical trial, data from that clinical trial can be linked with ALS Focus data. So then we have not only data on the clinical trial results, but we have data on firsthand from the people who participated on quality of life outcomes and on experiences and needs and preferences. So there's a way to enhance both sets of data by pairing them together. So yes, ALS Focus data, as I said, is de-identified using this global unique identifier, and then it can actually be linked to other sources of data that use the same global unique identifier, including studies from the CDC ALS, National ALS Registry, and other sorts of clinical trials. It's a way of expanding the impact of these survey data beyond just the questions alone.
Sounds like it's a multiplier effect.
Exactly.
Exactly. Now, you shared some information about the survey that was launched in the spring. Question, how do you decide what topics are important, and do people with ALS help you decide what questions to ask?
Yes, we have a patient and caregiver advisory committee. It's made up of, I want to say, about 20 members at this point, and we meet with them regularly to talk about survey topics and beyond that, specific questions for those surveys. Basically, this patient and caregiver advisory committee vets everything that we do so that it's never a situation where the research team is making assumptions about what's most important to the members of this community. We're getting firsthand accounts of what makes sense, what kinds of questions seem worthwhile, thinking about what can we do with answers to these questions. Our patient and caregiver advisory committee helps us to think through all of those different issues. It's a patient and caregiver-led survey program, and I'm lucky enough to be part of it and help put together the surveys that this group thinks is most important. In addition to the patient and caregiver advisory committee, we also work with a wider group of stakeholders, including people from the CDC, the Centers for Disease Control, from the Food and Drug Administration, from different pharmaceutical industry partners, and from academic researchers. And all in addition to leaders from our association chapters. And so we have insights from people that represent different kinds of important expertise in this area. And so we know that by the time a survey is available to the public, it has gone through review from a lot of different experts. And in addition to our experts who are on our patient and caregiver advisory committee.
Great, great. Oh, yep. A comment. Thank you for including caregivers. The disease impacts caregivers more than patients. And I can appreciate how that might be. Again, inviting people to provide questions or even submit comments. Perhaps there have been some folks on the call that have already participated in that first survey. Oh, good question. Can I still take the insurance finance survey?
That's a great question. So it's maybe a two-part answer. The first is that we technically right now that survey is not open on the ALS Focus survey platform. And let me just go back to that survey menu slide. There we go. So the insurance survey is not available, but we've basically collected the data from that survey and we're in the process of analyzing it, and that's why I was able to show you some results today. But we do think that financial burdens, insurance needs, those continue to be very relevant for these communities. And so we have thought through a number of different survey topics that continue to focus on finances and financial needs. And so we will be fielding those kinds of surveys in the future, as well as the possibility of reopening the first survey on insurance needs and financial burden, because those questions continue to be highly relevant. There's no need to stop asking those questions and getting insights, especially as, you know, in the era of coronavirus, in the era of different treatments, finances change and shift depending on what is happening in the world. And so we don't need to only have those data at one point in time. They're still relevant over time. So I guess the short answer is right now, you wouldn't be able to complete that survey on insurance needs and financial burdens, but we will have other surveys on those kinds of topics in the future.
Okay, great. That answered a lot, and it answered a lot, but generated another question about the frequency of surveys. The question is, how frequently are new surveys available? And if I sign up, will you just send me a notice when a new survey is available, I guess? Yes.
Excellent question. New surveys are available. I think it ranges, but it's usually going to be about 4 times a year, so every 3 months or so. And that follows the whole planning process with our research team and committee members. And when we launch those surveys, people who are signed up for the ALS survey, ALS Focus survey portal, they will receive an auto-generated email from that portal saying new surveys are available for you. And actually, we just sent out an email to participants talking about results from the insurance survey and telling them that the new survey is now open, and that's shown up on the screen here. So this survey is open right now.
So if people log on to the portal, they'll be able to participate in the current survey, and then they'll be notified when a new survey opens?
They will. Yep, they'll be notified by email. The people are, of course, welcome to check back. The portal stays open. So we have one set of questions called My Health Updates, and this pertains to ALS FRS-R scores and vital capacity scores. And so it might be that there isn't a new topical survey, but someone has gone to the clinic and received new scores and they want to update their scores. They can always log back in and update those scores, even if there aren't other new surveys available at that time.
Oh, that's great. This is really a customized or kind of personalized portal then. We did have some comments. Someone is reporting that the sound is garbled, so please let me know if you continue to hear garbled sound. As you may have heard earlier, this entire webinar is being recorded, so that will be available as a link on the ALS Association National website, where you can reach out to your local chapter for that, and that will be available in approximately 24 hours. Gosh, you've gone over quite a bit of information. It sounds like this is a fairly new program, but a lot of strategic planning had gone into it. Are there any other questions from viewers and attendees that have joined us this afternoon? And Sarah, can you tell us about how long
the survey will stay open?
Can you tell us? Yes, ma'am, exactly.
Yes. This survey right now, we intend for it to be open for a couple of months. We are able to change that depending on, I think, demand for participation. So if we see that there's still a lot of new responses rolling in, then we can adjust how long the survey stays open. The good thing is it's an actual team making the decisions here, and so we can adapt depending on what the needs are. So we don't have an actual date of when the survey will close officially, but please know that it will be open for the next couple of months at the least. And I also did want to
thank you so much. And you know,
oh, go ahead.
Well, I was just going to say it's so encouraging, because it sounds like you're really focusing on some quality of life challenges or issues, and it's so encouraging to know that people diagnosed with this disease and the caregivers are kind of part of that team that are helping with the development and design and input of these surveys.
Yes, I think that's an important part of this ALS Focus program, is that we are focused both on the people living with this disease and caregivers, who are so important and have, face challenges right alongside the person who's been diagnosed. And that's why we hope to hear from all of those different groups of people, because perspectives from each of them are important.
Great, thank you. And I think the last slide that you had up had your contact information.
Yes.
Before we close the webinar, I want to make sure people have access to your contact information. Oftentimes, folks will email us after the webinar has closed. So if you have any additional questions or comments, please don't hesitate to reach out to our program managers here. So email address right there on the screen, and of course the location of the portal there. It looks like we are a bit ahead of time. Are there any other questions or comments from folks that have joined us?
While we're waiting for those to come in, I also just wanted to mention that I will add a couple of different links to this slide presentation so that people can have that. One is to the results page of our ALS Focus website, and that gives more details on the results that I presented today. And then we also recently released a blog related to those results as well. And so that might be of interest to some of the people on this call.
Oh, fabulous. Excellent. Thank you so much. And again, this entire webinar is being recorded, so you can access the entire webinar post-live presentation. And Dr. Parvanta's slides will also be available with some additional information if you just want to access those slides and work through there. So I do not see any additional questions or comments. I thank you for carving time out of what I know is always a busy Monday. Please remember to be safe out there. And we'll look forward to hearing from another guest speaker bringing some information of a practical nature about nutrition and enhancing the dining experience during a journey with ALS next month. Thank you, Dr. Parvanta, Dr. Yursek, for managing this program. I know how important quality of life is while we're still on that journey to identify a cause or treatment and cure for ALS. If there are no more questions, I want to thank you for joining us. Again, be safe out there this afternoon. Have a good day.
Thank you, everyone. Thank you again.